My name is Dr. Mawuse Kanfra. I'm a proud beneficiary of the Merck Foundation More Than a Mother initiative. I've been a practicing obstetrician and gynecologist for the past 9 years, having been a doctor for the past 16 years. I used to work in one of the major hospitals in Ghana, in the eastern region of Ghana, where my interest in assisting women who wanted fertility was enhanced when I came across the burden that women with infertility faced. This led me to pursue further fellowship training in assisted reproduction and infertility in Kanfra Hospital, which is a tertiary facility in Ghana. Merck Foundation has helped me to increase my capacity in this field of endeavor. I graduated from Merck Foundation More Than a Mother initiative in Advanced Assisted Reproductive Technology in Udaipur, India. I must confess that this training has had a positive impact upon my practice. Hitherto, I was limited in how far I could care for patients who presented to me with infertility. Patients had to travel a long way, having been referred by many of my colleagues, just to know small investigations or have little contribution towards their treatment. With the training that Merck Foundation has given to me, now, from the time a patient sees me to a time where a final diagnosis is made has been limited. And this has improved patient care. My patients are now more satisfied with the care that I give to them. There's been so many successes for these 4 months after I completed this training in India. A lot of the patients who have seen me have conceived, having come across the enhanced knowledge and training that I've gotten from this training. When I finish this current training that I'm doing in the tertiary hospital, I'll move to the eastern region of Ghana. The eastern region of Ghana is the third most populous region of the country. Now, it has about 1,122 health facilities, but none of these facilities offer any advanced care in infertility. In the hospital that I'll be working with, the hospital has a 330-bed capacity. And though we are practicing general obstetrics and gynecology care for our patients, we are not practicing any advanced fertility care for our patients. It is my hope that in these few months, when I return to this facility, I will put whatever Merck Foundation has taught me into good practice. It is my hope that I will establish a good and a basic infertility care and add advanced fertility care to my practice when I go to this hospital. The future will be bright. Now, people will not have to travel the length and breadth of Ghana to access fertility care. Currently, fertility care is limited to only 2 major cities in the country, and people have to travel kilometers, miles to access fertility care. I believe that with the training that I have gotten, when I move to the eastern region of Ghana, I'll be able to establish a fertility care, which will be the first fertility center, which will be in the eastern region of the country. And patients around the region will be able to access fertility care instead of traveling a long way to access fertility care elsewhere. Merck Foundation has done a lot for me. The faculty that trained me is just a top-notch faculty. The facility that I was trained in Udaipur has the state-of-the-art facility to train in fertility care. In fact, I came across a lot of things that I read in books that were abstract and looked a bit weird to me. But when I went for the training, I realized that it wasn't so abstract. I'll recommend Merck Foundation to any doctor, any paramedic, any nurse who has the vision of providing top-notch quality care for our patients. Our patients deserve the best. Our patients deserve the best of care that we can give to them. I will encourage every medical person to take advantage of Merck Foundation scholarship programs and have expert training and adequate knowledge so that we can care for our people.